We are located just north of Dallas, in a little town north of Dallas, and it's a nice day here. It's actually been not as warm as it can be here in Dallas in July, so I'm pretty excited. It's actually been pretty decent weather here in Dallas in the 90s. Still hot, but not deadly. Scotty, hey, how's things? Scotty, is this Scotty from Kentucky? We got Frank here. We got Amber from Aurora. That's hard to say. Aurora, Maine. Alina from Bakersfield. Nice. Nope, Scotty from Alberta. Sweet. We got Brian from Atlanta. Elaine, Arizona. Seattle. Nice. I love Seattle. Seattle's one of my favorite places. I like to go up there whenever I can. Cool. California. Cool. We got people from all over. Nice. We got some Canadians, got a bunch of people from US, from Atlanta, from New York, California, Seattle, Arizona. Awesome. Good. We got a good group of people. Tara from New Jersey. Awesome. Guys, my name is, all right, we got some Dallas people, Bay Area. Love the Bay Area. My wife is from Bay Area. She's from San Jose growing up. Cool, guys. My name is John Hawes. I am the founder of NRSNG, and I lead this team of nurse renegades working to help you guys succeed in nursing school, pass the NCLEX, and move on and have incredibly successful careers as nurses. So thanks for joining me today. Thanks for taking 30 minutes out of your day to spend some time with me and talk about SATA questions. I'm excited for this. So we're going to run through this. I'm going to give you an example of a SATA question, and then I'm going to answer some of your questions. Now, the method that I'm going to give you to tackle SATA questions is actually very simple. It's a massively oversimplified method, but if you use this when you approach a SATA question on an exam or on the NCLEX, it's going to help you, and it's going to help increase your chances of getting that right. Now, there's a couple things to keep in mind when you take Select All That Apply or SATA questions. It's that you don't get partial credit, okay? You can get all of them right but one, and you do not get partial credit on the NCLEX. So you must get every single question right or every single answer correct, whether right or wrong, in order to get any credit for that question, okay? The other thing to keep in mind when taking NCLEX is that you can have anywhere from 1 to all of the answer options be correct. So if you're taking a question, NCLEX question on NCLEX, realize that one of them might be right, up to all of them might be right. And you could have as many as 5, 6 answer options, and it doesn't mean that because it's a SATA question that 2 of them have to be correct. It might just be one of them that's correct. So don't overthink that. If you see the one's right and you don't think the others are correct, that's okay. And realize that all of them can be correct as well. So if you're working through a SATA question, realize that all of them can be correct. All right. So how many of you guys are in nursing school versus how many of you are preparing for NCLEX? Amber's in nursing school. In school NCLEX. Wow, okay. Prepping for NCLEX. Cool. Awesome, good. So it's a pretty good mix here. We got about half in school and half preparing for NCLEX. This is going to help you regardless of where you're at in your nursing journey. Whether you're just about to take the NCLEX, this is going to help you as you approach those SATA questions on the NCLEX. And this is also going to help you in school get a little bit of clarity as you take these SATA questions. So SATA, again, stands for Select All That Apply. The method that I teach people whenever they see a SATA question is something called the SATA Success Pyramid. If you have some notes, if you have your phone, this is what I would take a note of. Screen is black. Is screen black for everybody? No, okay. Good. I'll just keep going and hopefully your screen pops back on. Yeah, I would switch to Mozilla works really well, and Chrome generally works for most people. So what we teach people, guys, is we teach what's called the SATA Success Pyramid. If you want to review this later, go into the test taking course and review the SATA module in there. So the SATA Success Pyramid is made up of 3 tiers. And this is what you do the second you read a question, and the very last words are select all that apply. So the minute you read select all that apply, you engage the Sata success pyramid. The first step in this pyramid is you cover all options. I don't have great handwriting, but the first thing that you do, guys, is you cover all the options. So you take your hand physically, or you do whatever you have to do. You cover your eyes, you put blinders on so that you can't read any of the options. All you can see is the question. Then what you do is you evaluate each answer option individually. So you've got the question, or you've got the answers covered, then you evaluate each answer option individually. You move it down one at a time. So you evaluate answer option A, then you evaluate answer option B, then you evaluate answer option C, and you do this individually. And as you do this, you turn each answer option into a true-false statement. So essentially, all that you're doing with these Sata questions, guys, is you're taking it from this question with multiple answer options that you have to evaluate if they're right or wrong, and you're turning each one into a basic true-false statement. Now, once you do that, you turn each question into a 50% chance of getting it right. So option A is 50%, option B is 50%, option C is 50%. But not only that, what I see a lot of people do, guys, when they see a Sata question is they'll have the question here, and then they got A, B, C, D, E, however many. And what they do is they start trying to associate all the different answer options together. They say, well, A is really close to B, and B is really close to C, and D is kind of the same as A, so it must be right also. So what you really have to do, guys, is you have to cover them up and answer each one individually. Once you've answered whether it's true or false, you move on. Okay, when you move on, you never come back. That's the biggest thing I see people do is they try to tie them all together. They say, well, this is a diabetic patient, so it must be right in this patient, and it must be wrong in that patient, and you start trying to build these stories that don't line up. So the minute you read, select all that apply, you cover all the answer options, evaluate each one individually, and as you evaluate it individually, turn each one into a true-false statement. All right? I'm going to try to share my screen here, guys. All right, can you guys see that? Great. So we're going to read a question, and we're going to practice. So here's the question. A 78-year-old client is recovering from a total hip replacement. Which information would the nurse give to the client that would help to prevent complications associated with surgery? Select all that apply. What is the first thing we need to do according to the Sata success pyramid? We just read select all that apply. What's the first thing we do? Cover all the options. Perfect. Since I'm taking on a computer, what I could do is I can honestly physically use my hand to cover all the options. If I'm not doing that, just make sure that you don't look at the B before you've evaluated A and determined on A. All right, so we cover all the options. What's the next thing we do? Evaluate each one individually as a true-false statement. Perfect. So let's go back to our question, and let's turn this into a true-false statement. All right. True or false, and let me work through this with you guys. I haven't really looked at this question yet. So true or false, after a total hip replacement, the nurse should give the client the following information to avoid complications associated with surgery. Okay, so true or false? After a total hip replacement, the nurse should give the client, or should tell the client, to utilize elastic stockings such as TED hose. True or false? True, 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 true. Great. All right. We all agree on that one. All right. True or false? And we're not going back to A ever again. We're never going back to this one. All right. So we're moving on. And that's, again, the biggest thing that I see people do is they begin to start evaluating each one based on what they answer on the next one. So we're never going back to A again. So true or false? After a total hip replacement, the nurse should tell the client to perform foot and ankle exercises. True or false? True, 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 false. Okay, I'm going to go with the majority. It says true. Okay, true or false? After a total hip replacement, the nurse should teach the patient to use deep breathing exercises twice a day. True or false? False, 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 false. Okay, I'm going with majority here. Majority says false, so I'm not selecting it, and I'm never going back to it no matter what. True or false? After a total hip replacement, the nurse should educate the patient to wash hands every morning and after touching the surgical site. False should be, okay, false, true, true, false. Nice. Elena's pulling out the absolute word one trick we give. All right, so the majority is saying false on wash hands every morning and after the surgical site. All right, again, true or false? After a total hip replacement, the nurse should teach the patient to take all anticoagulant medications as prescribed. True, 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 true. All right, looks like we all agree on that one. Perfect. All right. Should we submit this? We're never going back. I'm not rereading it. I'm not reevaluating. I'm not second guessing myself. Should we submit it? You guys ready? You guys dying? All right, let me submit it. Boom, we got it right. And then we can read our rationale. So let's read our rationale about the washing hands and the deep breathing. Okay. The nurse can teach the client to use proper hand hygiene to avoid infections. Hands should be washed before touching the surgical site. So up here, wash hands every morning and after touching a surgical site. That makes sense. We want to avoid any sort of infection or anything like that. Then it says deep breathing exercises and sinus spirometry should be done hourly while awake to keep the lungs expanded, which prevents pneumonia. So that's our post-op breathing exercises to help the patient from developing pneumonia. Great. So it's as easy as that, guys. Yeah, so that's one of the reasons why we're going to be doing the anticoagulants, but we need to be doing the foot and ankle exercises as well. Let's see. Because they're going to be immobile because they just had the surgery done on that big hip bone, we want to make sure they're moving that to strengthen it as well. Cool. How do I stop sharing screen? Let me see if I can figure this out. I'm not sure how to stop sharing it. So we'll just keep it sharing for here on out, guys. Cool. Here's what I will do. I can show you inside the Academy where you can learn the rest of our test taking tips and see more about select all that apply questions. Let me see if this is showing up for you guys. Perfect, it is. All right, so you go into the courses and you go into the test taking for nurses. We got some stuff on goals and studying and what is the NCLEX. This one's really, really helpful, guys, because it explains exactly what the NCLEX is and how it uses this computer adaptive testing model. For those of you who are more than a couple weeks out from taking the NCLEX, I would suggest studying this. For those that are closer, maybe don't study it so that it doesn't get you all anxious and nervous. So module 3 is the Sata success pyramid, and I've got it written out there for you guys. And then we've got a link to help you go to these FAQs by the NCSBN, who is the company that administers the NCLEX, so that you can go in there and you can see what these SATA questions are all about. So you can see directly from the source what to expect on SATA questions. Okay. Cool. SATA questions, I think, can be one of the biggest or one of the most scary elements for nursing students. So I want you guys to attack these. I want you to understand that they don't have to be that scary, that there's something that you can overcome, there's something that you can accomplish, and there's something that you can score well on. Don't automatically approach SATA questions as, oh shit, well now I know I'm gonna fail this one. Approach them with confidence and just answer each of the questions that you see one at a time, all right? And then as you do that, your chances of getting the question right improve drastically. Then what you can do, guys, is you can come in here to NPQ and you can take a bunch of questions, and as you encounter these SATA questions, just start employing this method and then really focusing on those areas that you're struggling with the most. Man, I wish I could stop sharing so I could. What happens if I do that? Oh, dang it. All right. Sorry, guys. Cool. All right. Who's got the longest streak on their NPQ right here? The highest I ever got was like 5, and then I stopped taking it. I could try that. I got 5, then the weekend comes. Yeah, that's the problem. Alina said, or Frank says, didn't you say SATA indicates the analyzing status of a question according to Bloom's? So, man, I don't, here. Let me go in here and I'll show you guys Bloom's taxonomy so that we can talk about what Frank is asking. So the NCLEX is based on something called Bloom's taxonomy. And essentially what Bloom's taxonomy is it's a method for determining how well someone comprehends something and to what level they really understand something. So it starts at the remember level that, hey, I remember that normal sodium is 135 to 145. Anybody can memorize that. My 8-year-old son can memorize that. He could spout that off, but memorizing normal sodium levels doesn't make somebody a nurse. So then it moves up to the understand level. Well, I understand why sodium is like that. I understand these sodium potassium pump. I understand membrane potentials and all that. So I understand normal sodium. Then you move up to the apply level, that understanding normal sodium levels and why they're like that, I can start applying that knowledge. And then we get to this analysis level, which is this highest level of comprehending something. That I can look at a patient's data, I can extract that this must be a sodium issue, and I know exactly what to do and how to understand and analyze that. So the question is, are SATA questions generally a measure of if someone understands or if someone's at the analysis level? The short answer for that is not necessarily. The longer answer would be that generally SATA questions are much more complicated questions because they require analyzing multiple different data points, and they require evaluating many different questions or answer options. So if you're getting a lot of SATA questions, it's generally an indication that you're answering more difficult questions and as such doing better, quote unquote, on the exam. Hopefully that makes sense. Okay, Elena says, after I did the test strategy modules, I read that NCLEX focuses on application questions. Am I able to filter questions on NRSNG to mainly answer application level questions? At this time, you're not able to do that. So in NPQ, we don't have it so that you can do it by Bloom's taxonomy at this point. That is something that we obviously, we're tracking. We understand Bloom's taxonomy. We haven't built it in there where you could say, give me only analysis or give me only application or give me only evaluation. So we don't have that availability yet. Sorry. So Brenda says, can you cover answer options during the actual NCLEX exam? So you do have a piece of paper and you do have a hand, or you do have a whiteboard or something, and you do have a hand. If you really want to take this to the extreme and actually physically cover it, you could. However, what I really want you guys to take away from covering all answer options is really the idea that once you select, start with A, once you determine true or false for A, don't ever go back to it. Never reevaluate A, move on, because what happens is you decide and you're certain about A, then you move on to B, you're like, oh, well, yeah, but if B's right, then A must be right. So really, it's about making yourself avoid doing that. Scotty, MPQ always has a lot of questions. So MPQ, about 35% of the MPQ questions are SATA questions. So there's a good chance, yeah, probably 1 in every 3 or so questions is going to be a SATA question. On the NCLEX or on the SIMCLEX through NRSNG, it won't, or it will, or it won't be more of SATA questions depending on how you're doing, because it's computer adaptive, just like the NCLEX. So what percentage do we recommend in each category? Amber, I'll get to your question. What percentage do we recommend in each category? We generally recommend you be over 50, 60% in each category on NPQ. Now, there's a couple other things that matter with that too. So for example, I'm 33% on ethical legal, but I've only done 3 questions. So that's not a really good indicator of my actual ability. Neuro, I'm 66%, but I've only done 3 questions, where labs, I'm 87, but I've done 8. So we recommend trying to get all your levels above 50. If you're at 60, even much better. But I think one of the best ways to do it is if you're currently studying a specific topic in nursing school, create a quiz on that topic. So ear, nose, and throat, for example, and do as many questions as you can and just kind of get an idea of how you rank there. If you're preparing for NCLEX, it's better to do much more broad selection of categories. So you can even do select all, come down here, do 50, and do a couple hundred questions a day even, and then that's going to start giving you feedback on how you're doing in all these categories. Now with endocrine metabolic, I've done 15 questions, but I've only got 20% right. So it'd be really valuable for me to go back into the metabolic endocrine course and take more there. Once I'm doing pretty well there, I can go in and take a SIMCLEX and see how I'm doing just as a SIMCLEX. Yeah, so if you do pop quiz, it's going to do completely random 10 questions. So see, this one's at integumentary from the management of care category. Let's see the next one. And this is why my score so low. I got that one right. I was going to say that's why my score so low. So this one's pharmacology. Let's see if we get another. Here's a select all that apply. All right, you guys want to do another one? You guys want to do this one together? I don't want you guys reading ahead. Don't read ahead. Okay? Don't read ahead. No one read ahead. That's the rule. If we do this, no one can read ahead. All right, I've said that enough. All right. So a 3-year-old child has diurnal enuresis. Which of the following are effective nursing interventions to decrease the incidence of enuresis? So enuresis, diurnal enuresis, the child is wetting their pants, essentially. So this is a 3-year-old child who's wetting their pants during the day. Which of the following are effective nursing interventions to decrease the incidence of enuresis? So the first thing we do, turn it into a true-false statement. So true or false, restricting dietary fluids, and what we're being asked is, which of the following are effective nursing interventions to decrease the incidence of enuresis? So true or false, restricting dietary fluids is effective at decreasing the incidence of enuresis. Yes or no? False, false, false. Okay. All right. So we're going to skip that one and we're never going back. True or false? Implementing a bedwetting alarm is an effective nursing intervention to decrease the incidence of enuresis. I agree there. Okay. True or false? Implementing a toileting sticker chart is an effective nursing intervention to decrease the incidence of enuresis. True, 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 true. True or false? Encouraging a high fiber diet is an effective nursing intervention to decrease the incidence of enuresis. I agree. I'm having a hard time coming up with a reason for that, which I shouldn't be trying to do. Okay, true or false? Restricting citrus fruits and high sugar foods is an effective nursing intervention to decrease the incidence of enuresis. All right, so we came up with 1 out of 5 as the right answer. This one's a scary one, guys. Even several years out of school, guys, I'm still scared. Oh, whoa. All right. We're going to have to consult Miriam on this one, guys. All right, let's see. Okay, citrus and high sugar foods can irritate the bladder, which worsens enuresis. Darn. Toileting sticker chart can be motivation for a child with successful toileting. We got that one right. And then high fiber diet will prevent constipation, which is a common cause of enuresis. Well, there you go, guys. There you go. Huh. So peds was not my favorite one, and it looks like I need to go back and watch the peds. Yeah, because I mean that's what I'm going with, Scotty, is that it's going to relieve some of that pressure probably on the bladder and help. Yeah. So there we go. Here, should we find another one? We need to leave on. We need to get ourselves some confidence here. Let's do another one. Let's find another one. Just skipping through these, looking for a Sata question. See if we get another one. Yay, got it right. How often do you guys take NPQ questions? Come on. Here we go. Daily? Cool, good. Yeah, I think it depends where you're at in your journey. Like if you're preparing for NCLEX, you'd be taking 100, 200 a day. All right, you guys want to take this one together? Sure. All of our confidence is down. All right, don't skip ahead. A student nurse is learning about supraventricular contraction and understands this abnormal rhythm originates in which of the following? Select all that apply. All right. Supraventricular. So true or false? Supraventricular contraction originates in the atria. I agree. Supraventricular contraction, true or false? Supraventricular contraction originates in the AV node. True or false? We got some trues, false, one false, some trues. True or false? SVC originates in the Purkinje fibers. False. True or false? SVC originates in the bundle of His. False. Okay. True or false? SVC originates in the ventricles. All right. Got it. That one we got right. I feel better now that we got one right. We need to beef up that rationale. The supraventricular. So even just going off the anatomy. So one of the tips we give too is going off the anatomy. If you haven't ever seen SVC or seen what it looks like on a EKG graph, just that supraventricular, going back to your med term, means above the ventricles, and then going back to your anatomy, the atria, of course, are above the ventricles, and the atrioventricular node is above the ventricles as well. Yeah, Joanne, exactly. Cool. So yeah, so Karina, how long should you be doing 1 to 200 questions a day? I would do it for 3-4 weeks leading up to the NCLEX. And we have some NCLEX study plans. If you go to the study plans tab inside the Academy, you can do one of the NCLEX study plans, and that'll help as well. Cool. Sweet, guys. Hopefully that helps a little bit. Going back to the basics here, and I was going to show you guys the book I talk about all the time, but the book I talk about all the time is the Test Success book. It's written by Patricia Nugent. It's a really, really great book. You don't need to go buy it if you know, a lot of the tips and stuff we give in the test taking course will help a lot. But if you got an extra couple bucks, it's Prime. Is it still Prime Day? If it's still Prime Day, whatever, head over and there's a book called Test Success, Test Taking Techniques for Beginning Nursing Students. It's by Patricia Nugent. I think it'll help you guys quite a bit. Actually, I guess I can just do this, right? Amazon. So this is the newer version, 27 bucks. I was going to try to find the older version for you guys. You can go in here and try to find the really old version of this book, Test Success by Patricia Nugent. And it's a helpful book. I don't know if she's related to Ted or not. Good question. Yeah. Cool, guys. If you guys need anything, you can always reach out to us. We're always here to help you guys. We want you guys to succeed. That's what we're doing here. That's what everything's about here. I really appreciate you guys taking 30 minutes out of your day to spend a little bit of time with me here in the tutoring. It's always fun to kind of get on here and connect. I wish my camera wasn't out. It feels a little more personal if I can talk to you guys, but we're always here for you guys. Please let us know what we can do to help. There's here, hold on. Inside the Academy, for people who are unlimited members, there is a chat bubble here. You can reach out to, right now, Cindy and Kenya are on. You can reach out to them any time of day, let them know your concerns. And you can also reach out to the Help Center, the Facebook group, and get a hold of us anytime you guys need. So, sweet, guys. I really appreciate you guys taking some time, and I hope you guys have a wonderful day. Happy nursing.